Welcome back to the International Training Institute of Health Masterclass. And what we're going to be discussing in this show is we're going to be discussing something that is really dear to my heart, and it affects all ages, okay, from the young to the old, and that is ear conditions. Now, understand something. The first thing we want to talk about is ear infections. And I'll tell you something. 95% of all ear infections can be prevented if parents weren't adulterated and if they would just listen to me, but they can't hear, right? Okay, the reality is that your children are suffering from all that wonderful yogurt you're giving them with that bacteria that's supposed to do so much. It's causing inflammation in them. The milk that you're giving them, the cheese that you're giving them, the dairy is the worst problem for ear infections, and we know it.
Just feeds the
We have
fungus.
taken hundreds, maybe thousands of children off of dairy, and their ear infections go away. Understand something. We have had parents who have put tubes in their children's ears because of scary dairy, okay? And then they've got them on antibiotics, and they've got them on painkillers, and they've got the tubes in their ears, which is causing more inflammation, irritation, and it can damage their ears even more. So get them on an
Whole plant-based
whole
diet.
plant-based diet.
that's right.
The perfect
Good.
day.
A non-inflammatory diet, a healthy diet, not the one that you're eating, okay? No sugar, no gluten, no dairy, and get them on a whole plant-based diet and watch the infections, the inflammation go away, the crying at nighttime, okay? The headaches, the sore throats, all of those things that are being caused.
Sinus congestion.
That's right.
all of it. They're all caves. So it's the fungus and the bacteria and all of these things. They like to hide out in caves. So our ears and our sinuses, and these are the perfect place. That's the perfect breeding ground for them. So
And just remember something. The same thing, the same tunnel that goes in your ear, you can take a little walk if you're a mini-me, and you could go to the back of your eyeball, and you could go to your sinuses down here, and it's all just one cave. So the reality is the scary dairy, okay, is getting through and creating fungus and bacteria and viruses, like Abby said, and it's creating that inflammation and swelling up their sinuses, swelling up the ear canal,
creating
and
so
it's
much mucus.
inflammation, infection to the inner ear, okay, and that's what's causing it. And I'll tell you something. We can show you how you can turn around not just infections, not just tinnitus, not just
Vertigo.
not just vertigo, but also if you've been gradually losing your hearing over the years, we're going to help you get
Yeah,
it back.
it can be reversed.
We're going to get it back. It can be reversed. And nobody's going to tell you this. And we've got the strongest protocol for reversing ear problems, eyesight, sinus problems. And I'll tell you, we've brought this into a whole different paradigm shift. And when people come to us, they can't believe it. People will come to us with hearing aids, and they will give us the hearing aids as a donation to say, thank you very much. I don't need these ever again. I know what to do. We had a lady fly over all the way from London, England, okay, and we were in Vegas.
We were in Vegas when we met him at the IAC
the IAC convention.
Yep, and she was deaf in her left ear. This is the right, in her left ear. Okay, no, it was her right ear, sorry. No, it was her left
ear.
left ear. And for 1 year, completely deaf. And she was losing it gradually. I worked on it for half an hour, didn't I?
At the convention.
At the convention. And guess what? She had her hearing totally come back. Okay? All right. And then she said that night, when I worked on her, that night she had the worst case of vertigo. The next morning, the vertigo was completely gone, and she has her hearing. And that was 2 years ago.
Yeah, and then that actually instigated her wanting to come and
take the
actually take the
courses.
course with her husband. Her husband came here with her, and he ended up removing his hearing aids.
He had
was with
hearing
us as
aids.
well.
So then we
He
worked
also
on
grew
him.
2 inches.
And he grew it. He
Oh
had
yeah,
hunchback.
we worked on his spine,
Yeah.
and he had spinal stenosis, and we worked on his spine, and he was 2 inches taller when we got done working through all the vertebrae. Guys, come on, okay? Who could even make up these stories, right? And then tell you that, you know, when you come, that we're going to give you a money-back guarantee that first treatment is going to
do more
do
than any other treatment for you that you've ever been to.
Yeah, and how's that? So what do you got to lose? So whether you've got any type of ear problem, we're telling you that we're going to get results and starting to reverse that, and you're going to see it. And then you're going to go home and you're going to start doing patting and clapping, and you're going to start doing the therapies with the silver and with the
nano drops.
And you're going to start doing the hot packs, and we're going to get your hearing back. We might get your hearing back in one session, or we may not, but in one session. But guess what? You're going to take it to the home plate, and that's the most important thing. And remember something. Inflammation's inflammation, and we're an inflammation nation, and it's everywhere, and it's the main root of all the problems. But the main root of all the problems is what you put in your mouth and what you put in your mind. But we won't get into that today because we will just be here
all
forever.
day.
Forever.
Forever and ever.
So that's why we want you to go into the Doc of Detox guide.
In the library.
Perfect
In the
guide. We want
library.
you to go into the perfect guide, and we want you to look at that on page 37, what the diet should look like.
Yeah, so in our Doc of Detox library, you can go to docofdetoxlibrary.com, of course, and you'll be onboarded to access all of our guides from there. So you can find the perfect day, and the schedule, like Dr. Will said, is on page 37 in that guide.
Yeah, and then you can go in there and you can also read or you can watch, and it's called Scar Tissue to Cancer.
Yeah.
And you'll find out that it's inflammation that causes it, okay? And you'll also find one in there that's called an Inflammation Nation that I'll be putting in there as well, okay?
All right.
All right.
So ear infections, of course, you can get outer ear infections, inner ear infections, or chronic ear infections. And we have already discussed how these happen. So if you've had chronic ear infections over time, of course, this can lead to other things like tinnitus and vertigo. So let's get into talking about tinnitus, which is a big problem in today's day and age. And I know one of my favorite movies, you talk about it, A Star is Born. And that was what that movie was kind of about, was he was suffering from tinnitus, and it completely took his life down. So it didn't need to happen. If we would have just been in that movie.
But he was also an alcoholic.
Yes.
And the sugar actually did it. It fried his nervous system, created all that inflammation, right?
And a big thing they say, because music artists are listening to loud music all day, that it could be just from the trauma from the noise that they get tinnitus, but really that's not the case.
No.
Of course, having too much loud music blaring in your
I don't
ears
know,
all the time can damage.
If you throw alcohol on a fire, does it get bigger or smaller?
It's going to get way bigger.
Okay, thank you.
Yeah, and honestly, I've worked in bars for a long years before I did this, and I listened to blaring loud music for I don't know how long, and my ears are not struggling. So it isn't.
And we're not
bad.
saying that it wouldn't do some damage,
Oh,
but
for
we
sure.
are saying that if you do the proper inner ear therapy that we have, it's going to reverse it.
Exactly.
And that's it right there. But don't think that we can come up against you being an alcoholic
No.
or a drug addict or
a
being
carb junkie or a
or
sugar
being
junkie.
on tons of prescription drugs that is just going to numb you down and make you so acidic.
Exactly.
So we can't do battle with that.
No.
But we can slow it down. We can actually make you feel better and maybe not have any pain, but to try to get and say that we're going to get your hearing back to completely back, we could never do that.
Yeah, you need to make the lifestyle changes to really have long lasting.
But even if you
results.
don't make any lifestyle changes,
we can still
we're
help.
still
We can
gonna do more.
reverse it to
We're
a
gonna-
certain degree.
that's
You're-
right.
It's not going to be so unbearable to have that ringing in your ears.
Yes.
So tinnitus, I'm going to just give the
ahead.
definition for everybody who's unsure. So tinnitus is the perception of noise or ringing in the ears. Tiny, delicate hairs in your inner ear move in relation to the pressure of sound waves. This triggers cells to release an electrical signal through a nerve from your ear to your brain. Your brain interprets these signals as sound. If the hairs inside your ear are bent or broken, they can leak random electrical impulses to your brain, causing tinnitus. And the medical cause is inner ear hair cell damage. And treatment that they offer is earwax removal or changing your medication.
Okay, so I guess you're
And they don't have any aftercare.
in trouble. Okay, and that's what most people are, and guess why? So now you get to go and buy that really expensive hearing aid, okay? All right, but at least you can turn it down and you don't have to listen to her anymore.
Yeah.
You know, and then and then on an emotional level, some people say that you lose your hearing because you don't
want to listen to somebody anymore.
That's
You don't want to hear it. I'm sick of it. I don't want to hear it anymore.
Yeah.
Stop.
Yeah. Until somebody says beer. What? No, I'm kidding.
And then you can hear perfectly. No.
Okay.
So what we do, we're going to talk about it, of course, in the ear treatment video. And we do have amazing treatments that we offer you to do at home to continue working with it. So I'm really excited for you guys to see what we offer.
And as far as vertigo goes, I don't want to give it a lot of attention because it basically means that you're out of balance.
Mm-hmm.
That's what you're out of balance, and you're out of balance because of this inflammation and because the signals are not being communicated properly through the nervous system to the brain. And that's what vertigo is. And as soon as you bring down the fire and you allow the nervous system to cool down, then you're going to find that this is going to turn. Okay? All right?
And last on our list is, of course, hearing loss. So hearing loss, also known as hearing impairment, is a partial or total inability to hear. A deaf person has little to no hearing. Hearing loss may occur in one or both ears. Hearing loss is diagnosed when hearing testing finds that a person is unable to hear 25 decibels in at least one ear. And so medical cause of hearing loss include aging, injury, excessive noise exposure, viral infection, shingles, drugs, meningitis, diabetes, stroke, hay fever or elevated body temperature, acoustic tumors, genetics, obesity, smoking, hypertension, and gradual buildup of earwax.
So everything.
Yeah.
So, yeah. So,
So
yeah.
they just
Everything
gave us
will
a list
cause
of
that,
everything. Yeah.
And I'll say that it's scar tissue, and it's not like it's big balls of it, but it's scar tissue enough that you can't get the vibration. The hairs can't vibrate properly, and it's inflammation and scar tissue formation. And and when we start to remove just that little bit of scar tissue in there, it just frees everything up, brings the circulation, everything gets flexible again, and the vibration gets picked up, and we're off to the races. But it really is about frequency, and it's about circulation.
Yeah.
It's about micro circulation.
Yeah.
Okay.
And we have a really amazing way to remove earwax without having to go in there and poking and prodding and pulling things out. We do it a little bit differently.
No, that's nasty.
Yeah.
That's nasty. You want to just gently, you want to soak it, have it just fall apart, and then just lovingly bring it out.
Yeah.
Yes.
So that wraps up all of the ear conditions that we have for you today. And we will be doing the ear treatment video. So if you are having any troubles with your ears, whether it be hearing loss, tinnitus, vertigo, or something else, whether it be chronic ear infections for your kids, stay tuned for the video because you do not want to miss it. This is absolutely life-changing for your ears.
And just remember, everything that we know, we teach, we train, and people come to us from all over the world. They stay with us. We have a condo attached to the clinic that overlooks the lake and the mountains. It's beautiful. With all the energy medicine equipment in it, people will come from 5 days to even up as much as 3 weeks, depending on the condition that they have. Or we send out Abby and Sage, and they go all over the globe. They're globetrotters, and they go and they either certify clinics or certify practitioners around the world, or they go and they do personal treatment and trainings for families.
And that's the thing, like you guys are coming to us or we're coming to you for your condition, but you're learning so much more than that. You're learning how to nutritionally run your life and how to work on almost every physical condition that we're talking about here today.
Yeah.
And so it's like we're not just giving you a piece, we're giving you the whole pie.
The perfect day, and we're going to teach you about your reactors. Do you know when you react, do you know why you react?
But what causes that reaction? What emotion is triggering that for you to have that reaction and start acting out in that general way? Like when somebody says something, why does what they say trigger something in me for me to attack them?
Yeah.
Or to me to attack myself, to go and eat that ice cream, to go and drink that alcohol, to go smoke that cigarette, or just to go and do self-loathing for an hour and calm myself down. Okay, this needs to stop. And all of this can lead to hearing problems. All of this can lead to any physical problem, because everything starts off in the invisible and goes to the visible. So we understand that thought form becomes
Physical form.
That's right. And then we create physical blocks that cause energy blocks that then create the inflammation to create the mutation. I think you got it. I think you heard us. All right.
Thank you so much for joining us, and we'll see you on the next episode, which we will be talking about eye conditions.
All right.
See you then.
Bye now. Welcome back, everybody, to the International Training Institute of Health Bodywork Masterclass. Now, what we're going to be talking about today is something that, this is something, isn't it? Everybody's losing their hearing, and it starts around even as early as 35. They start to get tinnitus, or they get ringing in their ears, or they get vertigo. Everybody's so inflamed, and there's no answers out there. Nobody can find them, can they? And then you start to gradually lose your hearing a little bit, and then there's absolutely nothing you can do except maybe try to get some earwax out or go get yourself some hearing aids. Well, I want to tell you something right now. You can reverse your hearing if you're willing to take personal action, and then let us do our body work ear therapy, where we go in and actually help to remove the crystallization, the scar tissue formation, and all the displaced calcium. And you may not know this, but a lot of your trouble comes from probably around your TMJ, comes from around your neck area, okay? A lot of things can play havoc on that inner ear, but understand, nothing plays havoc more than inflammation, because it's all about inflammation. Whether you're talking about a child that's got ear problems, well, that's from dairy, that's from gluten, that's from giving your child so many treats, sweets, okay? So the reality is that we're asleep at the wheel, and we have a protocol that will bring your hearing back, and we won't go into it, but we have testimonials up on YouTube in our website that show that we have people that have had lost their hearing for more than a year, even 2 years and 3 years, they get their hearing back. Okay, we have people that have hearing, but they need to have hearing aids, okay? We're talking about people lost complete hearing to get them back. And then people that have hearing aids that then give us their hearing aids as a gift after we work on them. Not sure what we're going to do with them, but I guess it's like putting something on the mantle, like something you shot or something. I'm not really sure. But the reality is, if everything that seems to be going wrong in the body can go right when you decide to create a new reality for yourself and live your life differently.
Definitely.
Yeah.
So like Dr. Wolfe was saying, so many people are struggling with hearing problems these days, and a lot of it is just because of the inflammation, or all of it is because of the inflammation that we find in the ears. So lifestyle choices are so important. Definitely going to our library, checking out The Perfect Day, and following our anti-inflammatory lifestyle is the first step to getting your life back and your hearing back. And then when we incorporate that with our therapies, you're going to hear better than you even thought you could.
That's right.
So
you know what? We take the impossible and make I am possible. And when somebody tells you, nope, there's nothing we can do, that's as far as their education goes. They're very limited, okay? Because that which created us had no limit.
Yeah. Always look for another option, because there's always a way. When there's a will, there's a way.
There is.
So some emotional blocks that can take place in the ear are going to be from traumatic experiences, which could be from like really loud music or working in a really loud environment. It can cause damage, but that damage that happened caused a lot of inflammation, which caused the scar tissue crystallization and displaced calcium to happen. So we can still get in there even if it was a physical blow to the area. And then you can have emotional blocks such as not wanting to hear somebody, or just like get out of my space, right? That's a big one. Or I'm sick of hearing my wife yell at me. I'm sick of hearing.
you're only going to lose your hearing if there's somebody you don't want to hear that's in your life a lot.
Yeah.
Okay.
And it is interesting. Apparently, men lose their higher frequency tones earlier than lower frequency tones, which are women's voices more than anything
Yeah,
else.
but you have to understand something. That's not a physical thing. That's an emotional thing because men can't get emotional.
Exactly.
Can't talk about their feelings. And their wife keeps on saying for 30 years, why can't you share your feelings with me? And he's tired of hearing that.
Yeah, exactly.
And, the problem lies with the men. But anyways, that's another show.
So with my tablet went a little weird there. Sorry about that. So with all the physical symptoms involved with the ears, you can definitely go check out our medical cause and treatment video to see how the medical system views all the ear conditions and how we view them. And that's why we're here right now, because we're going to show how we would treat it. So we are going to start, of course, check out the pre and post care video to see what we do prior to all of our treatments. And then similar to how we did the TMJ, so if you haven't checked that video out, definitely go do that. We are going to do the same thing with the ears, where we use the silver bullet solution in the ear. So you fill about 1 inch of silver in the ear. You let it soak for a good 10 minutes.
About quarter inch, you meant.
Quarter inch.
A quarter inch.
What did I say?
1 inch.
One inch.
Yeah, no, just a quarter. You don't want to go that
Yeah,
far.
so you're going to put a quarter inch, create a little pool in the ear. They're on their side. Then you're going to grab their ear, and we're going to rotate it. And
as you're rotating it, they're going to tell you they're hearing little crackles going on in their ear.
Snap, crackle, pop.
Totally.
And then we're going to use the Bioptron light, and we're going to shine that light in there. We're going to infuse the silver with light so that goes in and it does what it needs to do. We're going to then move on to the nanofulvic drops, do exactly the same thing. And while we're doing this, believe it or not, we're also doing the pelvic expansion, which we showed in the pre.
Yep.
And we're also doing the ear that we really need the work and we're working on. We have their hand in the avicen. Okay, so we've done all that and we've soaked the ear. Okay, and then we drain it.
Yep. And then the ear is prepared for the treatment. So we would start by beginning 2 inches at the top of the ear and working around. So you really want to use a pinpoint technique, getting really thorough above the ear, because you're going to find a lot of crystallization and displaced calcium in this area. It's going to be tender for the client, so very important to focus on the lion heart breathing and really get into that breath so they can release. And then you are going to follow around the back of the ear to the temporal bone.
So coming from the front, 2 inches above. And like as you're coming around the temple, you can work on the temple. Just go lighter. And then we're working up around the ear, 2 inches behind and coming all the way under the ear as well. 2 inches into the neck.
Yeah, and we go 2 inches into the neck to get into the vagus nerve to really get them into the parasympathetic state so that they're nice and relaxed for the therapy. And you're always using a very pinpoint technique. We're really very precise with this area. It's a small area. It's very much like surgery, and that is why we call it non-surgical work. And then we are going to come full circle around the front of the ear back to our starting point. And you are going to come in close to the ear.
You see here the little gold earring there where Sage is touching it right there. Believe it or not, we're going to put our elbow right there.
Yeah.
And Sage will tell you this. Look, I'm not like, well, what can I say this? I'm like everybody else. So I started getting ringing in my ears, didn't I?
Everybody's like everybody else.
I know. So,
but
yeah. So I'm like everybody else, and things are going to happen.
Everything happens to somebody.
So I started getting ringing in this ear. So what we did was, he went all around and worked it, but where he really got at it I didn't realize this. I put this program together years ago, and meanwhile he goes in here and he starts working right here. People will say, "You're in my ear." You're not. You're just right here.
Right beside it.
Right there. Okay? And he starts going in there, and what did he find? He found a calcium deposit the size of a small pea. So then he took that and broke that up, and believe it or not, the the relief I didn't know I had, I just grabbed onto it, and the ringing, okay, the ringing got worse that
It
night.
got worse that night. Yeah, he was
Because
like
more inflammation.
Well, because it loosened up everything and it really stirred up everything.
it up, and so it was just kind of like wow, wow,
And the
wow.
ringing
Yeah.
was gone. And you know what? I worked on a lady that was in London, England. And when I worked on her, it took me a half an hour. She had complete hearing back, and she didn't have hearing for over a year.
Yeah.
And she said that night she couldn't even walk to the bathroom. Her husband had to take her. And the next morning, she never had vertigo again. Well, at least in the last 2 years. And her hearing has always been 100%. So it kind of goes to that. So then we're going to go in there and we're going to loosen all that up. And remember, when you go around the ear, you're going to find things. So you're going to be there. It's not like...
And you're even going to go into the TMJ. You're going to go and release into the jaw because everything's connected.
You don't know their story. And remember something, depending on the emotion and what other emotions, that depends on where it is, how deep it is.
And that's why it's so important before we even sit down and start working with our client, we talk to them about everything. We go over their health history.
Yeah.
We see if there could have been a trauma that did happen to their TMJ. Maybe they did have some dental work and maybe that scar tissue is spreading into the ear. So we really are very thorough with everything that we're doing, whether it be just discussing beforehand or with the actual therapy. We're making sure we're getting in and playing every single angle so that we're not leaving any
Post-care and
stone unturned.
aftercare is just as important as the deep tissue.
Yeah.
Yeah, I was in Toronto giving a lecture, and the person that was putting on the lecture there, I was talking about scar tissue, and he says, you know what, I went and got work when I was a teenager. This guy's 50 years old. I can't chew without my jaw cracking.
Clicking.
Okay, clicking. So anyways, I went in there and I probably was in there 5 minutes and that was it. Okay, so that was actually about 8 months ago. I'm going to be seeing him, and I was just talking to him the other day, and he said, nope, didn't have a problem since. So what happened was he said that in 3 days, he got a lot of work because his insurance was running out when he was younger, because he was going to be let go of this job. So he was going to have dental insurance. So he said he got $3,000 work done on his mouth. So his mouth was open for like 2 days.
Oh, wow.
So what happened was he strained the area. So anyways, that's what it could take. So he's been living with that for how long?
Yeah.
Okay.
35 years.
There's- I had dental work done. I had a wisdom tooth taken out on this side. They just did the one because the other one wasn't ready at the time. And this one actually wasn't ready either because they couldn't get it. And they tried to pull it out and they cracked the tooth into a bunch of pieces. So it was still stuck in, it wasn't extracted, right? So he actually had to, I wasn't put under for it, just freezing, nothing else. So my mouth was open. I was probably there for a good 10 hours. He had to cut my jaw open and pick out each little shard of tooth, because if they didn't get every single piece of the root, it would have grew back. And I had the biggest knot in my TMJ for probably, well, until you guys were.
And
that
guess
was when
what?
I was 16.
That could take her hearing down. That will take her hearing down. Okay.
So
She would just need to progress that, stay on an inflammatory diet,
yeah.
not drink water. And
honestly, it was like
10
a
years
pretty
from now.
traumatic experience because it was so painful. The freezing kept wearing out. I could feel everything they were doing. I was in fight or flight the whole time. I was completely contracted, sweating. My hands, I remember my feet. Like I was back in that chair when I got that work done. And it was, yeah. So
All right.
the littlest things can cause big problems. And that's why we're here. And that's why we're doing what we do.
The princess and the pea.
Exactly.
And so when we get done, we're going to go over their care that we want them to do when they go
Yes.
home.
Yeah.
We're going to have them do things to make sure that it doesn't decide to stay, because like we told you before, you know,
Muscle
a
memory.
thought becomes a thought becomes a belief becomes a program, the program becomes a habit, and it gets muscle memory in there, and your body thinks it needs to keep it to protect you.
Yeah.
Okay, so we want them to do some things at home where hopefully they'll do things and buy into the idea by doing the research to get a Bioptron, get an Avicin, do the silver, do the fulvic, you know, do the ear treatment at home, get someone to help them,
Yep.
right?
And even soaking your ears overnight, if you do have a major problem with your ears, it can be absolutely incredible for pulling out that wax without causing trauma, because we're really softening it up, and then we're able to just go in and clean it
Yeah.
out after.
Let me say this. So you do it. So you do it, and you'll do it every night. You'll do it for a few nights. Even if you wake up in the middle of the night, you'll just maybe just get an eyedropper, put some more in, and you'll find within a few days it'll feel like your foot is in a rubber boot filled with water, and it really does feel like that in your ear. And you'll go in there, And I'll have people tell me that they've had to use like 5 to, I don't know, maybe 8 Q-tips, and all they're getting is all this guck out of their ear. So it's really good to do that even if you don't have ear problems and you're at the age of 40 or 50, because it's in there, right? So let's just clean it out. And when it's not hard and you're not jabbing, you're not going to hurt your ears. So yes.
Yeah. And that wraps up our ear treatment. So
All right.
we hope you guys enjoyed it, and we hope that it gave you some clarity, and maybe it will change your mind on your different steps that you might take into improving your hearing.
Yeah, we hope you've heard us. Okay.
Stay tuned for the next episode.
All right.
We'll see you next time.
Bye
Thanks
now.
for watching.